going to hand over to Roberta Pomponio, again from my team at Active Cheshire. Roberta's our Senior Strategic Lead for Physical Activity and Mental Health, and she's going to look a little bit more in more detail at the resources supporting MECC for physical activity. So Roberta, over to you.
Thank you, Mike. Well, I'm here to introduce the star of the show, really. I guess the reason why you all dialed in today is to find out a bit more about this training program, whether it would work for your organization or not. So the program has been co-designed, has been tested and piloted in Cheshire and Merseyside, but that doesn't mean it cannot be used across the country. And it is a very versatile and flexible program. The training is designed to be 2 hours long, but again, really flexible, depending on who your audience is and who your cohort of colleagues that you're training are. The actual training package, I guess, includes a slide deck, which is NHS branded because the NHS funded the pilot and the project, a session plan and a journal, which I'm going to talk you through in a minute. Everything is really flexible and adaptable. So don't let the 2-hour time limit tell you, oh my word, I'm never going to be able to find 2 hours to do this, because it's very flexible. It's very person-centered, I like to say. So the image you see there is the journal that comes with the training materials. It's a useful resource for people to use during the session, but also outside. It's a bit of a guide that will support people in embedding the MECC messages and the MECC approach into everyday at work and out of work. So the learning outcomes of the training are really quite simple. We're talking about tier 1 interventions, so real basic stuff. We're talking about increasing the awareness of what physical activity is, what counts, what doesn't count, and how much counts. But also familiarizing people with the MECC model, so the 3 A's, which I'm going to show you in a minute. So we are using, as Amrit mentioned before, the Ask, Assist, and Act framework, which is a framework that many people who work in the health sector are very familiar with. And that's, I think, the strength of this training, because if you already know the Ask, Assist, and Act of the MECC framework, then you're halfway there to having a powerful conversation around behavior change. And if you don't, but you're an expert in physical activity, then you have that half of the training covered. So one half of the program is around MECC. What is MECC? How does MECC work? What type of question you can ask? And the other half is around physical activity. So obviously we include the guidelines. These are the guidelines for England, because we're talking about NHS England clearly, and they are the latest version. They're provided on one page. We had many discussions on how to do this, but in the journal, you actually be able to have a poster for each of the groups of what is children, young people, older people, disabled people, and so on. So you'll be able to actually print off from the journal the pages that maybe are more appropriate for your group, and you have that resource there. We haven't made them, they exist, but it's easier to have them all in one place so people can use them when they need them, know where to find them. We put it all on one page so that we chunked it up to make it obvious what the difference between children, young people, and older people. In terms of the content, I haven't got the whole slides here, otherwise we'll be here for a few hours, but the physical activity content is just listed here. So we're talking about the importance of every moment count. If a person is inactive, the first 5 minutes, first 10 minutes of activity have a huge impact on their well-being. So it's important to start. People already active, yes, obviously have benefits from being active, but the starting point is where the impact is, which is great because it's a great selling point. So what are strength and building? We're talking about strength building activities. Again, one of the things we found during the pilot is lots of very competent and expert healthcare professionals knew about 150 minutes, or they knew about 10,000 steps. And most of them never considered the strength building activities, which are really key in the new guidance. And then a bit of language. What is moderate? Moderate means something different for me, for Jack, for Mike, and for everybody else. So what is the definition of moderate? All of this is done in a very interactive way. So lots of discussion, opportunities to share experience, thoughts, have a laugh, and so on. So we're talking about the data. So Jack shared some of the data. The pilot has been delivered for Cheshire and Merseyside. So the data you will find in the slide deck is for Cheshire and Merseyside, but we also providing the links for the Port England data sets that you can adapt and use for your own delivery. So very much adaptable to the local needs. We're talking about barriers. I guess great discussion because each place, each group of people, each person has got their own barriers. So again, some of them we can't do anything about, some of them we can. So working together as a group, we can share ideas and thoughts. And then, you know, tips on getting active. What makes, like, I love Bollywood dancing, so that keeps me active. I would never go for a run. So what do people like doing? It's all about this shared learning. And we do appreciate that e-learning is great because you can do it anytime. But face-to-face or virtual group learning has got so much more value to it in terms of the opportunity to share good practice and experience and knowledge with other colleagues. In terms of, again, physical activity approaches, we felt it was really important to share the consensus statement, which is an agreement, an agreed statement between Sport England and the Royal Colleges of of GPs around the benefits of being active outweighing the risk. There's always been a concern from healthcare professionals that there may be a bigger problem if they signpost somebody with complex illnesses to a physical activity intervention, then they may come back with a bigger problem. In reality, as long as people are kept safe and they identify, they know what are the warning signs, it's never a problem. It's never going to cause a problem to be active. It's always going to be a benefit for participants. And then we're throwing a bit of fun for some people. Some people don't like it. A bit of competitiveness quizzes. We have an animation that demonstrates good and bad practice. So again, an opportunity to tease out practice from participants in an interactive way. And then we focus again on the 3A's. So we're looking at practical examples of how we can use ask, assist, and act in the context of physical activity, again, to reinforce that concept. And then at this stage, we've gone past the midpoint of the training. We're into sort of the midpoint of the second part of training, really, and we put it into practice. And we've designed this in a way, again, that is usable by entry-level people, entry-level audience, and people already expert in having this conversation. So there is an option, which is this one, which is called the entry-level one, which is where the trainer handholds the group through a case study. So they start off with, what could you say in this particular case? They give an option of 3 possible answers. They have a discussion as a group, and then they list it the right, wrong, better, and etc. And this throughout the whole case study. There is a more advanced version, which is probably what you would use with either if you have more time or with a group of participants that maybe are more keen or more used to the MECC model, and which is a straightforward case study. So you put your delegates into groups, your case studies are in the journal, and you go and you get them to work on the case study and share their learning like that. So again, you have the opportunity to use both, either or none, depending on who your audience is. We just give you ideas of how you can reinforce the learning, give opportunities to practice it and put it in and make it real. There is also the option for trainers to adapt the case studies. So we give you example case studies, but you don't have to use those. So if you work for a particular group or with a particular group of patients, for example, then you can adapt your case studies to that patient group. So it's more relevant. There is a little bit about workplace. And Amrit mentioned it, you know, how important it is for healthcare staff to be healthy, be active. It's a very stressful job, takes up a lot of time and lots of pressures, and being active can help in many ways. So again, we have a video that we actually borrowed from another organization from YouTube, but it makes it quite obvious how people of all shapes and sizes can be active in many different ways. And again, an opportunity to have a conversation and discussion on what people can do within their own intervention, within their own organization, and be empowered to make colleagues active and so on. And this is the last element. So this is the signposting part of the course. Again, as I said, we are Cheshire and Merseyside for the pilot. So this is the signposting page to the resource hub, which is the altogether active resource hub. But if you're based in Berkshire, you'll be using the Berkshire related slide. We have included a generic signposting page, which leads you to resources that are available nationally. So in terms of movie medicine, for example, they give you specific indication of what type of activities are suitable for certain condition and so on. So plenty of resources available. All the slides are editable, so you can add, remove, etc., depending on who your audience is again. And then, like every good course, at the end, there's an option for an action plan. So we always like people who attend. I am as a trainer, I always like people attending a course, to bring something back with them. So an action plan, whether it's a personal one, whether it's one for the team, whether it's something for the whole organization, and so on. So there's an opportunity to go away with some accountability, I guess. And then we finish off with another resource, which is actually, again, not ours, but it's borrowed from our colleagues in Berkshire. And it's the Active Medicine Programme video that's been developed with the support of Sport England that can be showed in waiting areas. So in inpatients, in GP practices, it's just an animation that basically showcases what counts as physical activity. So it's a nice little gift we give to all the delegates. Then this is really, in a nutshell, a training that should really last 2 hours, but just to give you a flavor of what is included and what isn't really included in this program. I was trying to stop sharing, but I can't. So stop sharing. I found the button. Sorry. Have I got a couple of minutes, Mike? Still.
You absolutely have, Roberta, yeah.
Okay, so if it's okay, I'd like to just share the journal because I think it's something that we're quite proud of. I think, Nelly, don't you think? It took lots of effort.
Absolutely.
And I think it's a really useful resource. So it comes as a digital resource, and depending on your budget, you can print it or just send it as a digital resource. It's a booklet, as you can see, and it does provide activities that you can do during the training. So you have, well, this is actually pre-training, so you can send it before and allow your delegates to start thinking about what's going to be discussed and their own personal experience of physical activity, which is often one of the barriers to talking about it. And then in terms of the activities for the session, we have numerous case studies that you can see on a specific topic. So this one is assist. Then we have case studies, positive and negative experience, so good and bad practice. We have a series of activities to practice asking permission. This is something that British people are not very good at. They feel very conscious about asking permission to talk, so that's really important. And then we have a reflective listening practice, which I know a lot of you use anyway day to day, but if people are not experienced, it's a good activity to do. All of these can be used in class or not. In class, sounds like a teacher, or they can use outside as a self-development tool. So you can have, in a team meeting, you can have it as an activity about practicing reflective listening practice, for example. And more case studies. These are the sample case studies I mentioned before. They're sample, that's what they're called. And so you don't have to use these, but they give you an idea of what we're looking for. So you're welcome to change and adapt them to the needs of your group. And we do give you the right answer as well. So you have an example on this page about how a conversation, a MECC physical activity conversation should actually work. And then again, more resources. You've got examples, open-ended questions, which are key to the MECC message. So not yes and no answers, but more open-ended. So if you're stuck for ideas of how to ask questions, we've got some ideas for you. And finally, as I mentioned before here, you have all the posters. These are the Chief Medical Officer's physical activity guidance, and they have there are specific posters, some of you may be aware of them, for each of the patient groups that we work in, population groups that you're working with. So you could just literally print these and stick them on your desk as a reminder, or send them out to your to the people you're working with and so on. So this really whistle stop